acne in the past. New damage and bacterium acne. The fourth one, and all these factors can get together. See acne when I get activated, and it sebum produced by the testosterone hormone, dihydro and endosterone, and also stimulated by insulin like growth factor. So it when it's activated, sebum act like a good supplement for the bacteria. So it gonna grow and cause inflammation. It attracts sebum cubitus acne. Cubitus acne then produces TLR2 interleukin 1B, and that stimulates T helper cells. That stimulates that produce interleukin 17. That attracts a lot of neutrophils and monocytes, which in turn produces a lot of cytokines, which act like pro-inflammatory cytokines, which cause inflammation. It all starts by cubitus acne. Cubitus acne is commensal over the normal skin. It is a good bacteria and helps to suppress staphylococcus. But there are some bad strains too, which are called pathogenic strains. So the numbers of pathogenic strains gets high, and that causes the ultimate inflammation, which causes that coming down to rupture, and that attacks more bacteria, and attacks more by cytokines, and attacks more neutrophils. And it's ongoing process which get progressive, ended up in producing a lot of papules, pustules, cream, and nodules, cysts, and scarring, and everything. 80% of cases in genetics involved too, like congenital renal hyperplasia. So, polycystic ovarian syndrome and hypercortisolism plays the role too. So drugs can also cause acne, like steroids, lithium, phenytoin, INH, EGFR inhibitors, androgens, cyclosporin, and disulfiram, vitamin B2, B6, B12, and JK inhibitors. And there are a lot of others. And so the inflammation then we can come to the clinical features of acne. It divided into non-inflammatory compounds, and which are two types. Whiteheads, they are closed compounds, and there are open compounds which are called blackheads. And when compound opens, its sebum gets contact with the air, and air oxidizes the sebum, becomes black in color. So blackheads are open compounds. So wherever the sebum, sebaceous glands, it's a disease of sebaceous glands. So wherever the sebaceous glands are abundant, more in numbers, there we find the acne lesions. So like over the face, chest, and the back. The face is the most commonly involved. So, and the kids, there's a distribution like T zone, called T zone, like T, or like hand over the T, and nose and mouth, around the mouth. It becomes a T-shaped T. T is called T zone. So, in adults, it's distributed everywhere. So, it starts with the puberty, and 9 to 18 years it's gone by age 30. To severity, it's mild, moderate, and severe. In the mild, we find comedons and non-inflammatory and few inflammatory, and in moderate, we find pustules, nodules, few nodules, and in severe, we find cysts and scars and nodules and pustules, and more than 40 in number. So it can cause pain, redness, and tenderness. Sometimes it is associated with the fever, malaise, joint tenderness, like in acne conglomata and acne permanens. So it is associated with the psychological stress and increased depression and suicidal risk. So workup, which test we have to do, is basically to do clinical history and physical exam, and you can find coming pustules, papules, nodules, cysts, and hyperpigmentation and scars. And test we recommend the testing is testosterone and dihydroandrosterone, 17 hydroxyprogesterone level, and 21 hydroxylase level, prolactin level, and hemoglobin A1C level, and serum lipids. Now come to treatment. So we have to figure out first if it is mild or moderate or severe. But overall treatment, and we start with the tretinoin alone. Mild we can treat with the tretinoin alone, topical, and that works in most of the cases. So and then we can combine benzoyl peroxide with the adapalene, or we can combine clindamycin topical with the benzoyl peroxide and adapalene. So we can also combine tretinoin, clindamycin, and trade name is Beltin, Beltin, and we also can combine clindamycin topical with the benzoyl peroxide. The trade name is DUAC, DUAC. We can also use alone tazarotene, and trade name is Arezlo, Arezlo, Arazlo, Arezlo. I can also use clascoterone, clascoterone topical. It's a kind of androgen. Then comes the moderate acne. Moderate acne, we use combinations or oral tretinoin. And in severe acne, we can use oral tretinoin. And if a patient cannot take oral tretinoin, isotretinoin, and may try antibiotic clindamycin plus benzoyl peroxide plus adapalene, or any combination which has been not used before. And we can also use antibiotic doxycycline 100 milligram daily for 3 months. We should not use benzoyl peroxide and tretinoin combination together, because tretinoin neutralizes benzoyl peroxide, and benzoyl peroxide we should use in the morning in the form of wash after cleaning the face with the simple. With the benzoyl peroxide on the face, we should use apply for 4 to 5%. On the trunk, chest, or back, we can use 10%. And benzoyl peroxide can bleach clothes and hair, so we should not be very careful with that. And RAR, gamma, and RXR, RAR, alpha receptors, and A acts on all the receptors. And triferriton, and only selective for gamma retinoid receptors. So, dapolene and thioretin and acts on retinoid receptor beta and retinoid receptor gamma. So all of the retinol normalizes follicular keratinization, and that's why now it decreases follicular plugging and decreases sebum production, and decreases because of sebum is reduced, and that's why C. acne proliferation is reduced, and ultimately it reduces the formation of compounds. Benzoyl peroxide acts like antibiotic, and diminishes the Cutibacterium, and females, we can use oral contraceptive pills, especially for girls who has signs and symptoms of polycystic ovarian disease, and have hair growth and some menstrual irregularities. So they can use oral contraceptive pills, especially which has drosperinone, and ethyl estradiol. So can also use spironolactone. And spironolactone, we can start with the 50 milligram daily. If it ordered, then we can increase the dose to 50 milligram, to 100 milligram, to 150 milligram. We can also use eplerenone, which is well tolerated, what is less potent than spironolactone. What is better tolerated has less side effects and doesn't get gynecomastia, which normally we get with the spironolactone. Topically, we should use because it's photosensitive. Photosensitivity, so we should use sunscreen when going outside in the sun, and we should put on clothes with shirts with long sleeves, and we should avoid wearing shorts. We should put on cotton clothes, and because with a light color, because which absorb less ultraviolet rays, because cotton clothing is better sunscreen than anything else. So we should use wash our skin or face with the sun dead cleanser. Sun dead cleansers, they have a pH 5.5 to 7, and regular soaps has a pH of 9 to 10, so which causes more irritation and dryness. And we should also use it causes dryness of the eyes and nasal cavity, and dryness of the lips. So we should use artificial tears, and we should use chapstick with SPF factor 30, and we should keep the lips always moist because it causes a lot of dryness. We should also use saline nasal spray, and we should also use it causes all dryness of the skin. We should use liberal moisturizer, and best moisturizer is petroleum jelly. So, or if we have a lot of money, then we can use non-comedogenic moisturizer. So, other thing to watch, we should not rub the face or skin too much, as it causes more inflammation and it increases the acne. And don't play with the comedons. And if you play with them, then it causes more inflammation. And if you cannot stop, uh, I know the teenagers, they don't stop. They pick on the comedons and keep using them because they don't like it, because nobody likes it. Something black sticking from the skin. So they pick on them too much. And if we cannot stop, then use hydrocolloid dressing and cover it something with the dressing. So, but not too big. It causes more damage and more scarring, more acne. So it doesn't help. So before starting isotretinoin orally, we should join the iPledge REMS program, REMS REMS program, which females has to tested and 2 negative pregnancy tests, and then they are checked every month before they are given 30-day supply of isotretinoin by the pharmacy. They will see that a negative test before they give next 30-day supply of isotretinoin. And they should also monitor LFTs, cell lipids, and CBC monthly, and watch for increased intracranial pressure. And if LFTs increases more than 3 times normal, or triglycerides increases more than 800, then we should stop isotretinoin and try something else. Sunscreen we should use with SPF factor 45, because that blocks the both ultraviolet A and B lights. And we should just use sunscreen when we go outside in the sun every 3 hours, on any exposed area of the skin. And we should cover the whole body, your body, with the cloth as much as possible. Isotretinoin capsules should be taken with butter, because the fat increases the absorption of the capsules. The capsule contains soybean, so anybody with allergy to soybean should not be taking isotretinoin until they talk to your doctor. And a lot of people, a lot of doctors recommend taking twice a day, but I usually prefer to take altogether in the morning, because it's better and compliant. And sometimes kids forget to take pills twice a day. So at least in the morning, everybody up and ready to go to school. So parents are up to, and when before going to school, take it to isotretinoin capsules altogether at one time, and you took it early in the morning, and you're done for the whole day. In the evening, kids are wandering around and doesn't know when to come home, playing with the peers, so they usually come late and maybe miss the dose. So should take with the butter, and should take in the morning all at one time. And second thing, kids should take it honestly for continuously for 20 to 24 weeks at a stretch. They don't have to stop in between. And if you don't take it, and don't take it, if you don't want to, permanent cure. If you want, don't take it. If you want scars on your face for the rest of your life, don't take it. If you have lots of money to spend on the scars, treatments for the scars are very expensive, and don't take it. If you want girls or boys, don't date with you, don't take it. If you want to lose beauty of your skin for the rest of your life. Don't take it if you want to waste your parents' money. I can say only these things is for not to discourage you guys, but it's very important to take the treatment is for 20 to 24 weeks. So it's not the, the results will be permanent. It will be permanent cure 95% of the time. Only 5% cases they don't feel won't feel better, but they definitely felt some relief, and they can repeat the course. And when they have to wait for at least 5 months before they repeat the second course. Of complete cure is very good. So they should we should avoid pregnancy, and females and males, and they should avoid doing sex uh, for a month before and month after finishing the treatment to avoid scarring, because it causes a lot of scarring and hyperpigmentation and where the lesions resolve. And to avoid scarring, the treatment with isotretinoin is must. So they can avoid scarring altogether if we take the oral treatment honestly. And they can also use intralesion canalog injections should be given by the provider, and for any large lesions, inflammatory lesions, and we should inject large lesions with canalog. So that helps to take care of the scarring. So we can also apply cream or lotion, A and D. A means as like Azelic, as like acid, and niacinamide, and 10-xamic acid, and three medicines in combination, and is hardly available. It's hard to find here in USA, but it can. You have to order through the pharmacy. Also, you can use pulse light therapy and some foam fillings, and a lot of expensive procedures. So it's better to prevent by taking the isotretinoin than to spending a lot of money without any success. So it's very important to stick to the regimen and complete it for 6 months. So, when we are taking the isotretinoin, they recommend omega-3 supplements, and try to avoid a high glycemic index diet and high lipid diet. But there is no evidence of any dietary supplements that helps acne. And there are a lot of recommendations out there, but there is no evidence-based um, data that supports the any supplement. Avoid using tetracycline or doxycycline when taking isotretinoin, because it also increases photosensitivity. So, I think this is it. And best of your efforts. So stick to the plan, and it's very, very depressing and stressful disease for the kids, because they want to look beautiful, and this makes them take away their beauty, and destroy their skin and look. So it just can cause a depression, and it also increases the suicide rates. And some says it's the medicine that increases the risk. What I think is the disease itself causes a lot of stress, and that's why kids can cope with that and document suicides and also cause depression. So untreated depression can lead to anything. So it's not a disease that is not very much cure, and the permanent cure only with the medication, with the oral medication. A lot of doctors, they are afraid of lawsuits. They will not prescribe. Dermatologists, I've seen a lot of dermatologists will not prescribe because they have to monitor, they have to liable, and they will not prescribe isotretinoin because insurances they will not pay a lot of restrictions, and because medicine is very expensive. So and the insurance companies and because of liabilities, then a lot of dermatologists are hesitant to prescribe isotretinoin. So talking about the dose, so we should start with the 0.5 milligram per kilogram per day. So start with the low dose, 0.5 milligram per kilogram per day for a month to avoid acne fulminans. It's extensive acne, and that happens with the isotretinoin. It treats the disease, but it can cause bad acne too. So you should start with the low dose, and if everything goes well for a month, then we can increase to 1 milligram per kilogram, or 1 to for another month we can increase to 1.5 milligram per kilogram per day. So until total accumulated dose goes up to I think 200 something accumulation dose. Total you can check what is the total dose you could take in over 6 months. So once that usually it's well within the range. So we should start with the low dose, and then if tolerant, then go on full dose, 1 milligram per kilogram per day. So usually start with the less than 50 milligram, I think maybe 2 capsules, and more than 50, can turn out to be maybe 3 capsules a day. I recommend taking the whole dose, 2 or 3 capsules early in the morning with butter, and you are done for the day. So, and with this, we're going to end the video, and next time we will come with another video. Until then, bye bye. Thank you for listening to the talk.